As the Ebola virus swept through Western Africa in late 2014, tragedy, death, and economic ruin laid in its wake. The nations hardest hit by Ebola lacked the necessary medical infrastructure needed to contain the epidemic. An international humanitarian response was required to triage the situation and provide sustained treatment that could curtail the spread of Ebola. To make matters worse, medical teams didn't have access to quality mapping, and as a result, it complicated responding to and treating the most affected areas.
When the Ebola crisis hit, the epicenter of the disease was in the country of Liberia. The only maps available to medical teams fighting the spread of Ebola were over 30 years old and lacked the detail necessary for travel. For these reasons, the maps were very unreliable when trying to traverse from village to village across the country.
Ebola treatment teams were wasting valuable time and resources as they lacked the tools required to assess the hardest hit areas. Teams had difficulty distributing aid and simply could not reach areas outside Liberia's capital of Monrovia.
In stepped the National Geospatial-Intelligence Agency's Office of Geography. Enabled by up-to-date satellite imagery, the Office of Geography developed a comprehensive suite of products tailored for first responders and sustained relief efforts. The maps and human geography data sets were quickly made available on NGA's public-facing website. Easy access to unclassified GeoInt was essential as the relief effort spread to a wide range of militaries, governments, non-governmental organizations, and private relief organizations.
As a combat support agency, we are accustomed to supporting our military services for both training and exercises, as well as combat operations. However, humanitarian relief operations are difficult as they typically occur with little or no warning. That's the situation we face with Operation United Assistance, the U.S. military's response to combat the spread of Ebola. We knew existing digital content and mapping were woefully inadequate. Therefore, we developed a production plan that established a foothold in Monrovia, then quickly spread out as relief teams could physically move beyond the capital.
To give you an idea of what we're dealing with, 85% of transportation features, such as roads, trails, and tracks, were not accurate enough to use. If you remove the capital city of Monrovia, we improved nearly 99% of features across Liberia. That meant our team needed to adjust, create, or remove thousands of features in order to produce updated, accurate maps capable of supporting relief operations.
U.S. military personnel planned to arrive in Monrovia within 72 hours. Monrovia would serve as the logistical hub for all relief efforts and was a natural choice for our initial support. It was critical that our entire office was synced with the demands of the responders on the ground. Names and topographic content combined to enable complex epidemiology and analysis. Our content pinpointed the location and pattern of incidents that enabled the best placement of Ebola treatment units, personnel, and equipment.
As part of the overall relief efforts, our team delivered high-quality foundation data and extremely accurate and detailed topographic products. Both deliveries complemented our tradecraft by including transportation networks, political boundaries, geographic names, and human geography layers. Because of this, medical teams were able to plan response operations and anticipate emerging disease patterns to better assess what populations were most at risk.
It's easy to focus on capacity and miss the importance of responsiveness. We demonstrated that the Office of Geography can produce quality topographic content and mapping products perfectly tailored for the mission.
Since we tailored our efforts to our customer and used new and innovative techniques, what could have taken 2 years was in the hands of responders in roughly 75 days.